Everyone. Thank you for joining us on today's webinar. This is our webinar for TTAC on the Intro to Reducing Bias, Prejudice, and Racism, a cultural training for practitioners in clinical settings. My name is Meg Beyer, and I'm the Assistant Director of Strategic Operations at the McSilver Institute for Poverty Policy and Research. I'm one of the partners for the TTAC project, and I'm thrilled to be with you all here this afternoon, joined by my colleague Kevin, who is another McSilver partner, as well as my colleague Evelyn, who I'll introduce shortly, and our wonderful presenter, Dr. Dana Crawford, who we'll introduce shortly. So with that, just a few logistics before we get into our really important and critical webinar this afternoon. As we've done in the past, this webinar is going to be recorded, and it will be posted along with the slides to the TTAC website. We are going to be taking questions throughout the webinar, and what we're asking you to do is that you chat in your questions using the chat box functionality. You can see that on the right-hand side of your screen. And what we're asking is that when you go to chat in your question, you chat in your question to all panelists. We're anticipating that there's going to be quite a few questions today, and so we'd like for all of our panelists to be able to see what comes in. We'll be reserving time at the end to answer the questions. Please know we'll do our best to get through them all. We will collect all the questions that we have, but we might not be able to address all of the questions that we received today on the live webinar, just due to time limitations. For those of you who are joining us today who are LMSWs or LMHCs, we are excited to say that this webinar will be eligible for 1 credit hour. And that you will be receiving a follow-up email after the conclusion of the webinar with the further steps that you will need to take with NYU's Silver School of Social Work and how to obtain that 1 CE. And then finally, at the end of the webinar, right before we get to our questions, we are going to chat out a feedback survey using the chat box functionality. So if you look at where the chat box is, you'll see my wonderful colleague Kevin, who is using the username the McSilver admin host. He will chat out the link to the feedback survey, and if we're just asking that you take 1 to 2 minutes and fill it out. We really appreciate the feedback you give us. We share it with our presenters, and it really also helps us to understand your experience and how to enhance our future TTAC offerings. So with that, I want to thank you again for all joining us today, and I'm going to hand it over to my colleague, Evelyn Blank, who is the Associate Executive Director at the New York Center for Child Development. Evelyn?
Thank you so much, Meg, and welcome everyone. This is such an important and timely webinar today, so we thank you for joining us. I wanted to briefly let you know who we are. This is being sponsored on behalf of the Training and Technical Assistance Center, which is a partnership with the New York City Department of Health and Mental Hygiene that's funded through Thrive New York City. TTAC is a partnership between the New York Center for Child Development, NYCCD, and the McSilver Institute for Poverty Policy and Research. New York Center has been a major provider of early childhood mental health services in New York, with expertise in informing policy as well as supporting the field of early childhood mental health through training and direct practice. Our partner and subcontractor in this grant is the NYU McSilver Institute for Poverty, Policy, and Research. NYU houses the Community and the Managed Care Technical Assistance Centers, otherwise known as TTAC and MTAC, and they provide ongoing technical assistance and support with a focus on business sustainability. TTAC is tasked with building the capacity and the competencies of mental health professionals and early childhood professionals in family serving systems. We provide ongoing training and technical assistance, and I would like to direct everybody to our website, sorry about the slide there, and encourage people to go to our website at ttacny.org, where you can find archived resources as well as past webinars that we've presented and other resources. So it is now my privilege to introduce Dr. Dana Crawford. Dr. Crawford is a pediatric and clinical psychologist. She is currently the director of the Trauma-Informed Care Program at Montefiore Medical Group. She holds a joint appointment as an assistant professor in the Departments of Pediatrics and Psychiatry and Behavioral Health Sciences at Albert Einstein College of Medicine. She is also the developer of the Crawford Bias Reduction Theory and Training, which we're going to hear about today. She also has a private practice in Manhattan and New York. She has certifications in medical hypnosis and biofeedback. She has treated patients with high incidences of trauma in Philadelphia, Cincinnati, New Orleans, San Antonio, and New York. Dr. Crawford is a graduate of Howard, Temple, and Miami universities and has degrees in the areas of nursing, counseling, African American studies, psychology, and the arts. And finally, she's completed her pediatric psychology residence at Tulane University of Medicine, a 2-year clinical fellowship with the United States Department of Defense, and a 2-year fellowship with the Center for Early Connections at Tulane University. So welcome, and thank you, Dr. Crawford, for this timely and important webinar.
Thank you all so much. I have to say, whenever I hear my bio, I'm exhausted just hearing all of those things. And so thank you all so much for the opportunity to talk about this very important topic. I find it to be important. I've spent the last 10, 15 years of my life dedicated to it. But I think now more than ever, because as I think about what we're going through as a country, I've been saying that we are currently at the number 3 mark of pandemics. We're at 3 pandemics at once. The first is the obvious, COVID. The second is racism, which has been a secret pandemic for some groups, but I think for others, and depending on your worldview and your experiences in education, this is something that we have been fighting for centuries. And then lastly, the pandemic of economic uncertainty that I think we're going to be feeling for many moons to come. And so I hope today to be able to give you some theory on ways to manage these pandemics, but I think more importantly, to give you some skills that you can walk away with today and really start to tackle and reduce bias, prejudice, and racism. And so when we think about managing 3 pandemics at once, I have to be very clear that there is not a single human on this planet that has an expertise in managing 3 pandemics at once. None of us have ever lived through this. And so we're going to have to be giving each other some grace as we figure out ways to navigate and to improve how we treat each other. And so what I'm seeing already is that all of these, and zooming in on racism, but all 3 of these pandemics have very clear impacts. So the first is physical, managing COVID, managing many of the stressors related to safety are going to impact us physically. And that's not just physically in the sense of like our muscles and our bones, but also thinking about the ways that our body is connected. So our back, our stomach, our head. So we may experience more headaches, backaches, and stomach aches, or in other words, somatic complaints. Also relational. Many of these topics are triggering and invite us to engage the people in our lives about our opinions. And sometimes that can be quite provoking. And I've even seen that some relationships are ruptured because of it. The next is psychological. We are really being tasked with facing who we are as individuals, as communities, as a country, and that can be a very psychologically taxing impact. And then morally, the questions of are you a good person, are you a bad person has been coming up more and more, even as we think about organizations and them responding in the right optics and the right timing to respond to COVID, to respond to racism, to have sensitive language around economic uncertainty. And I think in the moral conversation, historically, there has always been a question of if you have racism, if you are racist, are you a bad person? And so we'll talk about that and the theory of what that does as we try and reduce our bias. And then lastly, our lifestyles. I literally just was looking at social media and they had a list of companies that were not responsive to racism, prejudice, and bias. And because of this, people were talking about boycotting. And so it's going to require a shift in our lifestyle and the ways that we have relationships with organizations. So many different impacts. And I imagine that this list is still not exhaustive. There may be people on the webinar that might be saying, what about this and what about that? I think the impact is very clear, and we may only be at the tip of the iceberg as we think about the impact that all of these pandemics have. And so managing so many things at one time can really cause us to shift away from being value-driven people that are very clear, and this is what matters to me, and this is what's important to me, to being emotion-driven. And this is because we're experiencing so many different triggers at one time. It feels as if sometimes the world is unpredictable. And I've been joking that 2020 has been the longest decade of my life, and it's only June. And I feel like as soon as I think that things are stable and predictable, there's another new thing. And it's very emotion-driven. And what happens when we're in our emotional state, we're not clear in what we want, what our outcomes are, and what our meaning is. And so our minds become so full of the noise of our emotions that we're not able to access our best selves, our skills, our expertise. And so it makes it really clear that in order to pursue our optimal health, and this is Maslow's hierarchy of needs, we have to address these specific needs. So it starts with our physiological needs, and that's food, water, warmth, and rest. I know you all can remember the days of early COVID where you couldn't even get toilet paper. This morning I was at the grocery store and I was like, oh my gosh, there's toilet paper here. This world is returning to some level of normal. And so that physiological need that we have for our body to be well cared for. And then there's safety. And I think that that's the piece that racism really targets us and impacts us in really big ways, because when you're experiencing racism, you don't feel safe. And then the next is that sense of belonging and love and need and feeling like your psychological health is, there are spaces in this world for you to pursue your psychological health, and racism, prejudice, and bias impedes that pursuit. And finally, self-actualization, being able to achieve one's full potential. And I want to be clear, when I talk about racism having this impact, I don't just mean racism in the sense of those who experience and are survivors of racism. I also mean for those who are racist and behave in racist ways, it does impact your ability to fulfill your full potential, because racism is something that impedes everyone. And so we really need some type of system to anchor us. Quite often, and I say this because if you're on this webinar, you self-selected to be on this topic. I think by default, everyone, and I will imagine I'm making a lot of assumptions, but it's an assumption in love, that everyone on here is striving to be the best person that they can be. You know, that you don't choose to go on a reducing racism webinar because you're like, yay, I really want to be racist. Let me learn how to do that. And well-intentions and good intentions are not sufficient, because we need actual skills to be able to navigate systems that have been in place well before any of us were born. And so before I get into what system I recommend, I think it's important to talk a little bit about how theories develop. And often when I go to trainings, I don't really get to hear the theory development. And so I'm going to just share a little bit, very short, very briefly, on my journey to developing the Crawford bias reduction theory and training. So I attended Howard University, which is a historically Black university, and it's called the Mecca of Black excellence. And one of the first things that we did in our freshman seminar class, we were asked the question, what was your first experience with racism? And, you know, it required a bit of reflection, because it was the question of your first. And I remember when I was in 6th grade, I had an argument with one of my peers in class, and it was just like a little kid argument. And she went running to the teacher, complaining that I had said something that I didn't say. And when I went to defend myself to the teacher, I said, well, I wouldn't say that. And the teacher said, your people wouldn't know those big words anyway. And I didn't know at the time what she meant by your people. I didn't really register that. I was just thinking like, oh, this teacher doesn't think I know big words. But later I realized, when I was reflecting in my freshman seminar class on my first experience of racism, how much that was anchored in race. And it had shown up in elementary school for me. And I imagine there are experiences that I had before then, but those early experiences really can impact the way that peers see young kids, as well as self-esteem, what children believe they can be, how children relate to other kids. And so having that experience of reflecting on racism really sparked the question for me is, how does culture, how does race, how does prejudice, how does bias show up in the world in general, but more specifically, how does it show up for psychologists? And so I started that quest of asking that question, and as I continued to pursue the question, I realized that a lot of the learning in psychology that I was experiencing were anchored in things that were historically excluding of minorities or were out and out racist. And so I pursued that education, and it was wonderful, and I was feeling like, yeah, I'm understanding racism, but I understood it from a really limited perspective. I was thinking of things like the Klan or the Civil Rights Movement and really explicit racism. And so fast forward, I graduated, I was, living my best life, and I decided it was time for me to pursue my PhD. And so I applied to all these different schools around the country, and I applied to Miami University, and I was asking all of my mentors to write me letters of recommendation, and they were saying things like, Dana, are you really sure Miami University? You don't really seem like a Miami girl. And I was like, I am so Miami. What are you talking about? And so when I went to mail the application, it said Oxford, Ohio. And I was like, oh, this is weird. They only have their Ohio address. So I called them and I said, hi, your website only has your Ohio address. I want your Miami, Florida address. And so then they were like, we're Miami University of Ohio. And actually Miami University existed before Florida was a state. And I had already done all the work and I had already gotten all the recommendations, and it was a really good research match. So I decided I would go ahead and apply, and I visited, and it was a really great, it was a beautiful town. And Robert Frost said that Miami University is the most beautiful campus there ever was. Now, I've also heard a rumor, and I've never seen this proven, I don't have a reference, but a rumor that Robert Frost also said if the world was coming to an end, I'd move to Ohio because that's how behind the times it is. And so when I moved to this town, I was around some folks that were very supportive, but it was a very predominantly white PWI institution. And so as I was navigating the classroom space, becoming a therapist, I started to experience the sensation that felt like racism, but it wasn't the racism that I had pictured. It wasn't the Klan. It wasn't, the Holocaust. It wasn't these evil, wicked people. It was actually some really kind-hearted, nice people that would just say things that just didn't feel good. And so these are some of the quotes as I was trying to figure out, and I was very disoriented and confused. So during my pursuit of my degree, I was, you have to get a certain number of clinical hours and experiences. I was running this dating violence prevention group in the middle school called Expect Respect. And you have to say it like that because it's like middle school. So it's like Expect Respect. And I was running this group, and I was called in by some of the leadership in the school. And they said, we're really worried that the kids aren't understanding your group. And I said, oh, is it too psychological? And they said, no, we're worried the kids can't understand you because of your Jamaican accent. Now, I don't have a Jamaican accent. I joke sometimes I'm a bit Jamaican. I wear my hair in dreadlocks. I love Jamaican culture, but I am not Jamaican. And I was really baffled how this group of people could come to a conclusion about who I was in the world based on my physical appearance, not based on anything that was anchored in the truth of who I am. But they were really kind and really nice people. Also, as you can tell probably already on this webinar, I am really full of energy. I've always been that way. I wake up really energized, and I'm very engaged. And so I would perform and be in this space of being my true self in the classroom. And I had supervisors that would say, you just seem angry and aggressive. And I didn't feel angry, and I definitely didn't think I was being aggressive, and I thought I was being an engaged doctoral student. Also, I would have patients who would say things like, oh my gosh, you're so pretty for a Black girl. And I remember at one point I was talking with a supervisor, really trying to talk about different experiences that I had working with Black patients and feeling like this sense of imposter syndrome at times, and I wasn't connecting in the ways that I was able to, that I wanted to. And I remember a supervisor saying, well, you're not like Black people. You're not like, those Black people. You're not like our patients. And really thinking that because of my education, I wasn't like patients from underserved communities. And then lastly, I have a cousin who's like working on her cosmetology license, and she wanted to learn how to do fake hair on top of dreadlocks. And so I had this beautiful, glamorous, like supermodel weave that looked like Beyonce. And I went to work, and some of my colleagues said, you just look softer. and nicer when your hair is not in dreadlocks. You should wear it straight like those Black women on TV. And this was really disorienting for me because these were people that I had great relationships with, people that I cared about, people that I respected, that were quite lovely. And so what I realized is that I actually know some lovely racists. And to this day, some of my best friends are racist. My kids call them aunties and uncles. And so in this process, it really helps me understand that racism doesn't equal who you are as a moral person in your character. And so I want to be really clear. When I talk about racism, I really think it's important that we shift the conversation away from the concept of racism of the Klan. So like getting together with a group of friends, burning crosses, killing people. To me, that is not racism. It's not bias. It's not prejudice. It's hate. It's criminal, and it's disgusting. So when I talk about racism, I'm talking about the micro ways that we're interacting when we're well-intentioned. I'm not talking about the explicit, hateful ways that people show up in the world. And so I want to be clear, I'm talking about more so microaggressions. The old adage is death by 1,000 paper cuts. So microaggressions is a term that was coined by Dr. Chester Pierce, a psychiatrist. He's also credited for helping Sesame Street be super diverse. So Dr. Chester Pierce's legacy, I think, continues so beautifully in the world. And then Dr. Sue really popularized the term microaggressions. And it really speaks to the everyday slights, the indignities that people of color experience all the time. But I want to expand that it's not just race, it's microaggressions regarding gender, regarding LGBTQIA status, religion, and it's the subtle ways that we interact with each other that doesn't seem like it's a big deal if it's one paper cut, but it's 1,000 of these that over time erode at the core of a person's being and how they feel safe in the world and how they're able to navigate and connect. And so when I think about culture, it's the silent participant in every interaction. So if you're having an interaction with a family and you don't think that culture is so relevant, maybe that baby is only a day old, it's always there. I share the story of when my oldest child was born. And a day in the hospital, one of my dear friends came to visit who loves me, who loves my family. And one of the first things she said, because my daughter's skin is a lot lighter than mine, one of the first things that she said is like, oh, look how light her skin is. And already bringing culture into the world, into this young baby's day-old experience. And one of my mentors, Dr. Marva Lewis, talks a lot about the ghost in the nursery, but related to culture. She talks about this concept of nappy-headed ghosts in the nursery and the ways that we project our cultural experiences, our fears, our worries onto very young babies. This image is from a series from Chris Buck in O Magazine, where he really aimed to reverse some of the assumptions that we make and how culture shows up in so many subtle ways. This image is, I think it really speaks to how early on in early childhood, children are exposed to racism, prejudice, and bias. So there are studies that show within the first 3 months of a baby's life, they actually show a preference for the skin color of their child caregiver. And basically, I think, as a person who was fortunate enough to be able to nurse her children, I think the kids are just like, who looks like they have some milk, right? So it's like, I like the person's skin who looks like the person who gives me milk. And so very young, very early on, children start to show that they are aware of race, prejudice, and bias. And then you add, as they navigate the world, going to the toy store, going to stores and seeing pictures of babies that are white on diapers, on the food that they eat, that nourishment comes from this source. And so it starts to give a message of where people are in the world and what is the center point, and everything else is othered. And so the American Academy of Pediatrics has said very clearly that it is the job of every pediatrician to become an anti-racist, because racism is harmful for children, both mentally and physically, and that racism is a socially transmitted disease that we should all be striving to fight and eradicate by being anti-racist. And so it has been said, one of my favorite scholars, Dr. or Professor Beyonce Knowles, has said that racism is so American that when we protest racism, some assume we're protesting America. And I think our charge for this generation of Americans is to shift that America is and can be so much more than our roots that may be anchored in racism, that are anchored in disenfranchising people of color, specifically American Indians and Indigenous people, but that doesn't have to be our story. And so it becomes really crucial that we tear apart that idea that racism is American. No, what I think is American is that this is a land where everyone can have opportunities and resources, and that we need to strive and do a lot better, that everyone is a lot more expansive. And so there are many different forms of racism, and I think it's important to point to make that really clear. So when I talk about racism, I'm not just talking about one form. So individual or personal racism is the thought, like the thinking, your cognitions that are thinking you are better than someone because of their skin color. And I think that's where the defensiveness comes in, where people think of this as the only definition of racism. So if you don't have racist thoughts and you're not prejudiced in this way, and you're not consciously thinking these things, if someone was to say that you were racist, of course you would be defensive, because you're like, I don't think that. That's a terrible idea. That's disgusting. Why would I think I was better than someone because of my skin color? But that's just one form of racism. There's also interpersonal racism, and this is where the microaggression pieces come in. It's the little things. Like just this past week, I was on the news and I posted a link, and one of my colleagues from grad school said, "Oh, Dr. Crawford is so articulate," as if someone who is a doctor would not be. And so her and I had this really beautiful dialogue where we talked about, you should probably use universal language when you are examining and commenting on scholarship. And so if you wouldn't describe a white person in this way, you probably shouldn't describe a person of another ethnicity or race in that way. And so interpersonal racism are the ways that our language is so saturated and our expectations are saturated in these belief systems that it shows up in our relationships. Institutional racism is the way that the structure, so I think that's the part that when people think you're protesting America, when you're protesting racism. So it's the institutions that have been created to keep certain people in a certain position based on who they are. And so Jim Crow is a very classic example of institutional racism, but more recently, stop and frisk. So stopping people and putting policy in place that positions certain people at a greater risk. Or doesn't allow them to have certain resources. Cultural racism, this is ways that another term for this might be cultural appropriation. So this is how one group is allowed to perform in one way and another group is not. So for instance, right now in our legislation, there is this act called the Crown Act. And what it says, and it started in the U.S. military, where soldiers were not allowed to wear their hair in dreadlocks or braids. And if they wore their hair, it was considered unprofessional and not soldier behavior. The Crown Act expanded into the public sector, where actual businesses could say, that's unprofessional hair, and could choose not to hire someone based on them wearing their hair in a way that I'm wearing my hair. And so the Crown Act is the policing of one culture, when in reality, I think there are many different ways that I see white groups perform, and their hair is not policed in this way. And so cultural appropriation is what is allowed for one group is not allowed for another. Think about when one of your friends went on a Caribbean vacation and came back with their hair braided. And so that's cultural racism. Lastly is structural or systemic racism. This is when the very policies put in place, although they may be trying to change, perpetuate racism or prejudice or classism. So I think a really good example of that is internships. So if your institution is saying that, anyone that is an entry-level person, they need to have done, 100 hours of internship. Now, it is very privileged to be able to work for 100 hours for free. And so historically, people that are from families that are closer to the poverty line are not going to have access and the ability to do internships. Oftentimes, disproportionately, people of color have had experiences because of systematic racism of not being able to do free labor. And so structural and systemic racism are having policies in place that don't explicitly say we're excluding this group, but because of the structure and the way that things are set up, it doesn't allow access and excludes people. So when I use the term racism today, I'm talking about all of these different levels, and it's very complex. And so I want to be really clear in all of these examples that I bring out. You know, I don't think that people that are doing these things are bad people. So if you're participating in this webinar, some part of you does not want to have bias, racism, or prejudice. You desire the best patient or client care. You want to connect with the families. You want those families to be heard and understood. You want to feel safe at work in the work that you're doing, and I imagine in the world. You don't want to cause anyone else to feel unsafe, and in short, you really value diversity. And so all of us on this call are privileged. We have privilege to the internet. We have privilege to be in a space where we're invited to have professional conversations. And so privilege, when I use that word, sometimes people say, well, my life has been really hard. Like, I've gone through some really difficult things. I want to be clear. You can be privileged and your life could still suck, possibly, because bad things happen in the world. Privilege just means that it hasn't been the cause of your life having difficulty isn't because of your skin color. It isn't because of your gender or your sexual orientation. Those aren't the things that are making your life hard. And it's sad that we live in a world that literally that is the definition of privilege. And I think that definition does allow us to open up space to say, yes, maybe I've been disenfranchised, maybe I've had some difficulties in life, but it wasn't because I was white. Those things didn't happen because of this. And so when we think about developing a theory and understanding ways to reduce bias, the traditional approaches to supporting diversity and multicultural trainings really did start by opening up conversations of understanding diverse presentations in the world and ways that people are different. But the next wave that I'm calling and challenging us as a profession, mental health experts and multicultural experts specifically, is to shift from this perspective of othering. So these are 6 core problems that I had with the first wave, or criticisms rather, or invitations for growth for multiculturalism. So the first is othering. So in traditional multicultural learning or traditional trainings you've gone through, if you're reading a multicultural book, it'll start out with how to work with like African Americans, how to work with Latinx folks, but maybe it was Hispanic, how to work with LGBTQIA, how to work with Muslim. But there was never a chapter on how to work with white people, how to work with white men. And so by not having that chapter, what it does is it positions white masculinity as the center of normal, and everything else should be understood from that point as other. So others, rather than equalizes and say, hey, these are all the ways that humans exist in the world. The next is it traditionally positions people of minority status, racial minority, LGBTQ or sexual orientation minorities as experts and not as learners. So historically, you might go to a training and there's a Black woman, a Latina woman standing up, giving this training, a gay man, but rarely have minorities had the opportunity to explore in a multicultural training things like colorism, things that are really related to intra-cultural matters, but instead, because of othering, it's all understanding things from the white, heterosexual, or cis perspective. The next is whiteness as a race and a culture goes underexplored. And that's very problematic because what happens is if white people, if you all don't have the opportunity to ask the questions of like, what was my first experience of recognizing that I was white? What does it mean for me to be white? What are my cultural values? If that doesn't happen, then it becomes really hard for you to recognize and connect with ways that someone else's culture is particularly relevant for them. And so it doesn't allow whiteness to go explored. The next is it's really guilt-inducing for people of privilege. I know when I've gone to certain trainings because of certain privileges that I have, I leave those and I'm like, oh my gosh, like the world is terrible. You know, I don't know, I'm just so privileged. I should just, you know, be culturally humble. I'm just going to be humble. And so that goes to my next point, that a lot of these trainings focus on increasing your awareness. And then, like, what am I supposed to do? So now I feel terrible. I'm more aware of the injustices that humans have. And what am I supposed to do about it? And so lastly, this idea that cultural competency is this lifelong, long, complicated journey that you're never going to be, you know, you're never going to arrive. And as a person who did all the school, telling me I'm never going to arrive at any level of competency is not motivating. And so I think it's important that we actually start to put some skills out there that we can like measure and say, yes, I have this skill. No, I don't. This is the area. And I think the idea that this is a long, complicated journey is just not compatible with all of the things that we have to do in our fast-paced work environment. And so we've really been left with this point where we are well-intentioned, but we don't have the skills to do anything about those intentions. And so, like, where has healing, where has skill building happened? When I do these trainings, I ask a room of 100, 200, 300 people, how many of you have gone to a multicultural training where you felt like you walked away able to repair a cultural rupture, to perform as an advocate and do that skillfully? Very rarely do more than 5 people, 10 people raise their hands. Also, does it happen with friends and intimate relationships? If you think about the last election, how many of your friends and your intimate partnerships, how many of those people actually disagreed with your point of view? Probably not a whole lot. Like, most people are probably in line with your belief system because we tend to surround ourselves with people that we agree with. And if you did disagree, were there opportunities for you all to connect and actually talk about that disagreement in a healing, skill-building way? Probably not. With our family, I mean, you can just Google how to survive the holidays with your family, and it will be really clear how much we are not ready to have these cultural conversations at the dinner table. Our media, if anything, I think our media has perpetuated a lot of the bias, prejudice, and racism in the world. And lastly, professional trainings. I've done trainings where I've been told by organizations, make sure you don't go too deep in the cultural or the race stuff because it's just too sensitive. And so healing doesn't happen and skill building doesn't happen. And so the reality is we are all infected with the socially transmitted disease that is racism, prejudice, and bias. And we got this disease, this socially transmitted disease, by our backgrounds, our cultural environments, our personal experiences, biased media representations, our social experiences in the world, and the repeated exposure to stereotypes and prejudices, and they start to become our long-term memories. And then on top of that, even when you're out here doing the work, you're reading all the books, you're watching the videos, you're doing all the stuff that's on the list of things of how you can reduce your bias, how you can not engage in toxic masculinity, how you can stop being racist, how you can stop, being all of these different ways in the world. When you're working under these 4 factors, you're more likely to have bias, prejudice, and racism. So first is the time pressure. If you have no time to reflect, you're going to respond based on your own history and learning. And if that history and learning is, contaminated with the socially transmitted disease that's bias, prejudice, and racism, it's going to show up. Vague and confusing situations, if you don't have all the information, you're going to fill in the information based on your own history. So if you're working with a young family and you're not sure what's going on, you're going to make some assumptions that are based on your own biases. The next is too much information at once. So if you have so much information and you can't discern what is important, you're going to base what is most relevant on your own history and experience. And the last, if you're not paying attention, if too much information, if too much of your time is multitasking, you're not going to be able to parse out ways that you're having a biased perspective. I personally don't know any jobs that these settings are not the case. I'm always working under a time pressure. Working with patients, a lot of times I get really vague information. Sometimes I get way too much information, and I'm always multitasking. And if you don't believe everyone's multitasking, just think of yourself on this webinar right now. How many of you are checking your email, text messaging, trying to do multiple things as you participate in this webinar? And so, in short, bias, prejudice, racism, it's in the air we breathe. If you're breathing, you're going to get some racism all up in your lungs. It's just part of the process. And so you can be culturally biased and a good person. And I think it's really important that we stop asking about my intention and if I meant that, and instead start to shift to the impact. And so I think about, the focus on impact and not intent. So if I'm driving down the street and I run over somebody's bicycle, I might not have meant that, but they still can't ride their bike. And so it doesn't matter how much I didn't mean it, the impact is still there. And I need some skills, or I need to pay them, or I need to do something to fix it so they can ride their bike, right? And so when we think about cross-cultural, intercultural relationships, it becomes really important that we stop asking the question of your intention. Like, yeah, I'm glad you didn't mean that, but I still got this paper cut. I still can't ride my bike. And so to shift, it becomes really important that we're really focused more so on impact. So I mentioned that we need to have an anchor. We need to have some type of system to help us navigate this. This is one system that I recommend. I obviously recommend it because it is my name. And so the Crawford bias reduction theory and training, the theory is that you can be a good person and still have racism, prejudice, and bias living inside of you. And so to get rid of it, not likely. To reduce it, absolutely. So the reason we can't get rid of it is because racism, prejudice, and bias defends itself. It always comes back in new ways. Like, humans are so creative in ways that we don't include each other. If you don't believe that, just think about how racism changed pre and post 9/11. It's like a whole new world. Like September 10th, nobody was thinking about being prejudiced against these groups of people, maybe a few people, but then the whole world shifted. And I think about the people in my life that I really care about and their experiences because of them having lighter skin, if they're perceived as being Muslim, and their experiences as traveling after that experience, and they're not even part of that community. So racism stays being creative. Therefore, we have to stay being creative and reducing the impact. So first is the awareness, and that's the first wave of multiculturalism. It's being aware. It's all the trainings that you've gone to. The next is the investigation. And when I first developed this model, I used to call this identification, but identification felt finite. To me, investigation is active. Like when someone's under investigation, it's an active and engaged process. And what we're investigating is what triggers your bias, prejudice, and racism. Like, what activates it? And the next, we're investigating how it manifests. What does it look like in the world? The next is the reduction. We're trying to reduce what? Our bias, our prejudice, and racism, and the impact that it has. And so we're going to go into this a bit. Now, I want to be clear, I'm using a lot of race examples, but I also want to be clear that we are all multicultural. So when I think about being multicultural, these are all the different ways, and this is from Beulah, and it's not just these things are here. It's not meant to be all-inclusive, but it's things like our race, our ethnicity, our gender, our age, our socioeconomic status, our religion. And I would highlight in the land of COVID, our language, but not just our spoken language, but technology language. Literally before this webinar, we were talking about the different levels of how much me as a speaker, I felt technologically competent and fluent in the world of technology. And I have to be honest, in this world where we're challenging each other to be more inclusive, I am really worried about some of my colleagues that maybe are not as technologically advanced and how they will not have access to giving their voice in this land of COVID where we're living on a webinar. Like, some people just can't do that. The other piece is even the comfort of having one's image recorded or someone having an image just portrayed out in the world. Like right now, I literally have no idea where I'm being broadcast. And I think in some religions and some spiritualities, that's very problematic. And so we all carry so many different multicultural identities. And depending on where we are, some of them are going to be more relevant than others. So for example, if I walk into a room and I'm the only person in the room that is a woman, I am very aware of my gender. Or for example, when I walk into a preschool, I am very aware of my age. And so it really shifts in how big that circle is for you. And there are certain groups, although how relevant that culture is, expands and shrinks depending on your environment, there are some clear ways that in this world, some groups are socially oppressed and other groups are socially privileged. And obviously there's overlap, hence why it's a Venn diagram, but it becomes really clear that we acknowledge that historically some groups have been oppressed and others have been privileged. And those come with years, decades, centuries of ramifications for how those groups get to navigate the world and the resources and the privileges that they've had handed down generation to generation. And so now we're going to shift. So all of that first portion was a lot of awareness. Even before I introduced you to the model, we were doing awareness. But now we're going to dig deeper into the investigation and the triggers piece. So some of the signs that you might be triggered, I call these the ABCs plus P. So effectively, it may be fear, anxiety, anger, sadness, but there may also be excitement. This isn't all negative. So for instance, a few years ago, I was working with the patient population that I was working with, the neighborhood changed a bit, and we were getting a lot of refugees from Yemen. And I've never worked much with people from Yemen. I had seen things that were going on in the news. And so I was really excited because I'm always interested in working with all types of people. And I was like, wow, a new experience. And so I remember these families were coming in, and this is de-identified hodgepodge. And I was talking with a mom, and I was like, hey, well, tell me what it's like raising kids in Yemen, and like, how are things here, and like, what was your experience? And she was like, I really just want to talk about my kid not sleeping at night. And so when I talk about being triggered, it's not a matter of if it's negative or positive. It's that when I look at that multicultural identity, instead of being able to see the entire wheel with all the little circles and bubbles around it, instead I zoom in on one, and I'm viewing that person as a caricature of their whole identity. And so that's the marker of being triggered. I'm not seeing the full human. Behaviorally, it might be yawning, frowning, adjustment in eye contact. I may be getting too close. Cognitively, I may have judgments. I may be quick to diagnose what their problems are, or even that they have problems. I may have flashbacks, and I'll talk a little bit about this later, about my own experiences, or excessive curiosity, like I had with this family from Yemen. Physically, and this is the last piece that I added to the model, it has to do with how your body feels when racism, prejudice, and bias shows up. So this is the heart palpitations, the dry mouth, the tense muscles. A few months back, I was in a store, and I had all these bags with me because I had purchased some shoes, and I had it was just like doing some shopping. And this guy came up to me and he said, excuse me, can you hold this, like my shirt, and can you please tell me where the bathroom is, and then I'll come back and try it on? And I said, well, why would I do that? And he was like, you work here. And I had like a coat on, I had bags. I was like, I don't work here. And he was like, oh, it's not a big deal, I'm sorry. And I said, well, I think you might have said that you're being a little bit racist. And he said, well, I'm not racist. I'm Latino. I can't be racist. And I said, well, you might be a little bit. And I just kind of walked away and left it there. And I think about that experience. My heart was beating fast. I had a dry mouth. My muscles were tense. I'm like, am I going to say something? Am I not? Is it really a big deal? It's a microaggression. Should I make a whole big deal? I'm with my family. And so I had a physical experience. And I also felt like it was important not to let this thing go. And so when we think about the ABCs plus P, it's that we're feeling all of these things effectively, behaviorally, cognitively, and physically as we're engaging the bias, prejudice, and racism. And so the triggers can be a variety of different people. It's not, I think the research is traditionally asked, what is it like being triggered multiculturally when you're working with clients, when you're working with youth, when you're working with kids and families. But in my research, when I interviewed therapists from all over the country and asked them about how culture comes up for them, the biggest triggers were actually colleagues. And administration and supervisors and supervisees. It's the system of the people around you in the clinical work, not just the clinical work itself. And so, you know, we know that for a fact that racism, prejudice, and bias shows up in many different ways. The literature shows that implicit bias, for example, this is just one example, there are many different examples. It shows up in the ways that OBGYNs counsel people. It shows up in the patient-physician relationship. And we know really clearly that Black women are 3 to 5 times more likely to die in childbirth than white women. And so one of the really startling studies, when I hear that, I remember I read this quote in NPR where they said a Black female doctor is 3 to 5 times more likely to die in childbirth than a 17-year-old white girl in a trailer park. And so what is it about race that leads to these horrific health outcomes? And it's not just in the medical sector. I think, you know, as the protests and the rallies and the coming together in the world are showing right now, is that it's in all sectors. You know, the entire world is infected. And I think it comes down to this piece that often Black pain is ignored. And the research shows that, you know, when Black folks report physical pain, less pain medication is given by emergency room doctors. Reports of racism are often shifted from impact statements to intention statements, and they get whittled into those pieces that really are not acknowledging the pain and the trauma that is really present. And so I think that's how we perpetuate these things. And so as we continue to move through the model and focus on manifestations, I want to give you a real feeling of what it may be like when you're triggered. So when it happens in the world, you have the language to go, oh my gosh, I'm triggered. And then we'll talk about what do you do when you're triggered. So I'm going to forewarn you. In a moment, Kevin is going to play the video. And the forewarning is this video is about shooter drills. So in schools, kids have to do drills where if there is an active shooter in the school, similar to, I don't know the age of people in here, but when I was younger, we used to do tornado drills and fire drills. Now young people have to do active shooter drills. And so in this video, it's a conversation between a mother and son talking about his experience of shooter drills. So if Kevin, if you would please play that video now, that would be great.
What emergency drills did you have as you were growing up in school? Fire drills and tornado drills, and that was it. So can you tell me exactly what happens in active shooter drills? The teacher's supposed to lock the door, turn the lights off, and push this big desk behind the door. And the first time I did an active shooter drill, I saw her having a hard time with it, so I decided to come help her. Because if she doesn't get the desk on the door in time, the intruder can open it. So what do you do next after you push the table? The class is supposed to stand on the back wall, but I decided to stand in front of the class because I want to take the bullet and save my friends. So did your teacher ask you to stand in front of the class? No. My life matters, but it's kind of like there's one person that can come home to the family, or there can be 22 people that come home to the family. Do you know why it's hard for me to accept that? Because I'm such a young age, I shouldn't really be giving my life up. Like, you shouldn't have to worry about that. Right. If there's any a time that I want you to be selfish, it's then. I need you to come home. So, would you still stand in front of your friends, even with me telling you not to? Yes. I get that you would want me to come home, but it's really not a choice that you can make. It's a choice to have to make. I see now that there's nothing I can say that would change your mind. I just hope that it never comes to that. Talking about this makes me feel sad, but you raised a good person. This is why I can't have the conversation with you. You keep saying things like that, and I'm speechless. You are 10, and you're that 10-year-old who doesn't clean their room, and there's no handbook for this. This is why the conversation always ends between you and I in dead silence, because I'm a mother, and I don't know what to say.
And so I want to take this moment to just invite you to think a bit about what gets triggered for you. Effectively, for me, it's sadness, it's pain, it's behaviorally. And so just take a moment to breathe and think about what gets triggered. And so as we think about what thoughts come up physiologically, we feel this racism, we feel this bias, we feel this prejudice. And in this video, the highlight wasn't race. It's childhood, and it's really nuanced. It's gendered, it's the little boy. It gets triggered in ways that we think about, why does this little boy have to sacrifice himself? Why do our children have to live in this world? And so we're feeling those ABCs plus P. And so it tends to have a psychological impact, and it's self-blame, it's a decrease in self-esteem. We may feel backaches, stomach aches, headaches. It can be very depressing, have anxiety, trauma, shame, fear, guilt. And it's really uncomfortable, and it's real life scary as well. I think sometimes when we think about racism and prejudice, we feel embarrassed, we feel ashamed, especially as we think about ways that we have performed and behaved in ways that are racist and prejudiced. But the reality is we also have fear that if we say the wrong thing, we do the wrong thing, we might be fired, we might be sued, we might be assaulted, we might be killed because of it. And that might be because of our race, but it's also potentially because of our gender. It's also because of our sexual orientation. It's our religion. And so it's not just race, it's prejudice, and it's also bias. And it's very real stakes that are on the table. And so when I think about this, in reality, these worries have made us become so fragile. And we've become fragile because somewhere along the way, we started having this belief that these types of conversations are supposed to be comfortable. I don't know where that came from, that talking about something that has such high stakes would be comfortable. Also, that the discomfort should be avoided. And the belief that uncomfortable conversations about race are intolerable, like I can't handle it, which is completely a myth. Recently there's been so many conversations about white fragility in particular, but also fragility, privilege fragility in general. And this idea that we are all fragile beings. I assure you that every single person on this call has done some tough things in their life, right? And you have faced things that at some point in your life you've made the sentence, I didn't think I could go through that. I can't believe I survived it. I can't believe I've done that. And I know that to be true because life is hard. And so we are not as fragile as we think. The other part of that fragility is that somewhere along the lines, it became clear that the responsibility was on the racial minority specifically, or the minority in general, to teach white folks how to tolerate racial conversations, to teach, straight people, cis people, how to have conversations about LGBTQ. And so I think where that myth has come in around this fragility is that, the minority is at risk for not being safe. And so therefore we have to caretake to be safe. But sometimes we caretake in ways that we don't have to. We don't have to take care of our white brothers, sisters, and non-binary siblings. And I think on the other hand, our white brothers and sisters and non-binary siblings have to say, do not take care of me. I got this. I can handle it. And so as we start to navigate becoming a more equitable world, I invite us all to either stop caretaking in ways when we're not at risk for safety, or to stop letting people take care of us. We need to step up and grow up and be willing to be uncomfortable and do the work and not expect someone else to teach us these things. And so all of this stuff, when we're triggered, when we're feeling it and we're in the grit of it, because we're all good people, none of us is walking away. None of you are working with a family, seeing that sweet young baby, seeing that toddler and just saying, you know what, it's way too much cultural stuff in the room. I can't take it. I'm walking away. You stay in it, but it manifests that you're activated. That trigger is still there. And there are three core ways that it manifests. The first is moving away, and this is when you distance yourself, and it's a continuum of denial to withdrawal. Then it's a moving towards, where you get in a superhero mode, and the last is you're moving against, and this is when we start to over-pathologize and have condescension. More specifically, it might be withdrawal. It might be referring that patient or that client somewhere else. It might be silencing by not asking open-ended questions, but instead, when we're activated, we only ask closed-ended questions because we don't want expansive dialogue. Or it might be humor in ways that are not funny and not engaging. Or this one, and this is the one that most people claim, like the superhero mode. And this is when we have an exaggerated sense of responsibility. And this is when we try and go above and beyond. And so my favorite example of me doing this is I had a patient that I absolutely adored. She was amazing. And she stopped coming in for therapy. And so I gave her, I called her twice, and then I sent her a letter, which is a typical way that you close a case. And then she didn't respond. So I called her again, and then she still didn't respond. And so then I sent her a telegram, right? So like, that's ridiculous. And it was because of my own stuff, and I had this exaggerated superhero mode. But in reality, we do all three of these modes. The last is the critic mode. And this is when we have anger, irritability, we engage in these heated arguments, we have sarcasm, we diagnose like, oh, they're totally bipolar, and you haven't done any assessment. And all of these are the three different dances we do because we're trying to cope with the fact that we're triggered and it's too much. And so the last piece is the reduction and the bias, reduction of the bias and the impact. And so this is an acronym. It stands for listen, and you're not listening to the patient or the family or the child in front of you. You're listening to what triggers you so you can hear the person in front of you and not your bias. You're empathizing not with the family, with yourself, your own pain. The next is telling your story, and not in an oversharing, moving towards superhero way, but in a strategic self-disclosure using an I statement. The next is understanding your larger role, this larger system, what impact, rather than focusing on your intention. And lastly, it's psychoeducation. So it's correcting unhealthy thinking patterns, making it very clear through your, because silence can be viewed as collusion, making it very clear that you do not collude with bias, prejudice, and racism. And so when you're activated and triggered, rather than staying in that triggered space of those ABCs plus P, the goal is to let up so then your mind can be focused on what's in front of you and the experience. I'm not going to go, I was going to give you a patient example, but for the sake of time, I'm going to kind of move through that. I want to recognize that this work is hard. It at times is uncomfortable, and sometimes you are not safe. And so the goal of this work is to recognize that and to build your stamina. Sometimes we can think it's too hard, and so we don't do it. Instead, it's to build our stamina in this work. Some action work that I want you to do when you leave this space is to discuss with a friend or a trusted colleague ways that you've learned racism, prejudice, and bias, and then talk about, using the let-up model, how you would have done it differently, like a cultural do-over. It's important that you practice these words because you're not going to get a special invitation that says at 3 p.m. today, you're going to experience racism, prejudice, and bias. So prepare, and this is going to be the scenario. It happens in a micro moment, and it's critical that in that micro moment, you respond. And you will not have the skills to respond in ways that are in line with your value-driven self rather than your emotion-driven self unless you practice getting your mouth used to saying the words. And some anchoring questions as you do this work: what are my values around this issue? What am I defending When you get defensive, what are you protecting? What do you have to defend? Is this conversation anchored in humility, respect, and love? And how can I let up? And so the goal is for your mind to move from your mind being full of all of this to being mindful so you can be in your value-driven state. Now, I'm going to end this conversation with this video. It's my favorite video in the world, and it really talks about ways that culture come up. And let me know, Kevin, if for whatever reason you can't hear it, but I think you all should be able to. Oh, it's not letting me click on it. All right. Okay. Thank you, Kevin.
Do you remember what was going through your head when you first saw me?
I remember when the doctor pulled you out, the first thing I thought was that he was being too rough with you. And he actually held you like a little Sprite bottle, and he was like, here's your baby. That was the most proud moment of my life. Don't tell your brothers, because it's 3 of y'all. But it was like looking at a blank canvas and just imagining what you want the painting to look like at the end, but also knowing you can't control the paint strokes. You know, the fear was just, I got to bring up a black boy in Mississippi, which is a tough place to bring up kids, period. But there are statistics that say black boys born after the year 2002 have a 1 in 3 chance of going to prison. And all 3 of my sons were born after the year 2002.
So, Dad, why do you take me to protest so much?
I think I take you for a bunch of reasons. One is that I want you to see what it looks like when people come together, but also that you understand that it's not just about people that are familiar to you, but it's about everybody. Did you know the work that Martin Luther King was doing was for everybody and it wasn't just for black people?
Yes, I understand that.
Yeah, so that's how you got to think. You decide that you want to be a cab driver, then you got to be the most impactful cab driver that you can possibly be.
Are you proud of me?
Of course. You my man. I just love everything about you, period.
The thing I love about you never gives up on me. That's one of the things I will always remember about my dad.
You said it like I'm on the way out of here or like I'm already gone.
So, Dad, what are your dreams for me?
My dream is for you to live out your dreams. It's an old proverb that talks about when children are born, children come out with their fists closed because that's where they keep all their gifts. And as you grow, your hands learn to unfold because you're learning to release your gifts to the world. And so for the rest of your life, I want to see you live with your hands unfolded.
So thank you all for your time today. I hope this presentation has created a space that will help you live with your hands unfolded. Thank you very much. We'll open it up for questions.
Thank you so much, Dr. Crawford. This is really powerful, and I think it's the beginning of a dialogue. So thank you for all your insight and wisdom here. Before we take some questions, I just wanted to encourage people to please fill out the evaluation in the chat box. Very important for us to get feedback. It really helps shape our further trainings, and we very much use these and look to them. So thank you all. So a few questions here. One of them is how do you process or confront client intolerance, racism, or bias while providing unconditional positive regard? Basically, is it possible to be an ally while providing effective care to an individual who is racist?
Yes, you know, one of the things that I do in the longer training is the let up model and to role play it. And so that has come up many, many times in the conversation. And so a really short example is to say, to really ask the question, the trauma-informed care question of, instead of what's wrong with this person, what happened to this person. So what has happened in the world that would make a person become so sexist or so saturated with racism? What have they been exposed to? Asking that question from a curious place, and then also saying, you know, labeling it, you know, that thought that you're having about women having a specific role in this world is bias, is sexist. And in my worldview, I don't agree with that, and that's hate language. Here, we're going to talk about all the ways that you are in the world, and I welcome that. But in the same way, if you were drinking too much, if you were doing drugs, I would challenge that. And racism is also something that I'm going to challenge because it's not healthy for anyone.
Thank you. Another question: Can system racism exist without people being racist? Wouldn't perpetuating systematic racist policies be racist?
I think absolutely perpetuating systemic racism is racist. You know, as I mentioned at the beginning of this presentation, there are many, many different forms of racism. And so as I talked about racism defending itself, you know, we can try and eradicate every single systemic racist policy in the world. And I guarantee in a few months, there's going to be a new policy that we didn't realize, because humans are not always as aware of our, well, that's the part that good intentions is not sufficient. You might have very good intentions and then it has an impact. So constantly having a relationship to the impact of what we do is the critical piece to decreasing systemic racism.
So somebody said that they have a few meetings set up with their staff to talk about racism, and they wanted to know whether you had any suggested questions to pose to really get the conversation started.
Yeah, so the first couple of questions to pose are not anchored in racism. The questions are anchored in safety, and it starts with, what are the ways that as a group, we're going to make it clear that this space is safe or not safe? What are ways that we can give each other space? I think it's crucial that these conversations with racism don't start with having people of color explain their experiences of racism. You know, it in some ways is trauma voyeurism. Instead, it's making sure that, as one of my colleagues said, you know, Dana, you're really good at breaking the white ice, like that white people are talking about their experiences as well, that everyone has a space to talk about what is experienced, but that's done in a space where people are not asking to be caretaken, and it's also done in a way that people can communicate that they don't feel safe. And so some language pieces, if you feel unsafe, you might say, I don't feel comfortable having this conversation right now. Maybe we can pause it for another time. I'm feeling a little too emotionally driven in this space. Or if you're trying to invite safety, you might say something like, I'm really wondering how I can create a safe space, a brave space. Maybe if I did this, this would be helpful, like having another colleague join us, only having the conversation in bite-sized pieces. And the other thing is informing people when you are going to discuss something that's very triggering, similar to how I did on this training, where I said this video could be activating for those who don't like the word triggered. It could be activating for you, or it could be potentially very triggering, and letting people know that in advance. And giving people permission to have spaces where they take a break from the conversation.
Important. Somebody asked, how can I measure discrimination against immigrants from the perspective of the perpetrators?
So measurement, I guess I'm a little bit unclear in that question. How do you measure the impact of discrimination? I think that's more of a metrics question. But I think the critical piece is that you honor people's self-report, that if people are telling you that's their experience in the world, asking what are some ways that we can shift that experience and decrease the bias, prejudice, and racism that they're having. I hope I'm answering the question. I don't know if I really got to the heart of what you're asking.
Great. And okay, this is the last question. And somebody says that they have a male friend that is African-American but very light-skinned. He only dates Spanish and white girls because he said that African-American girls are so ghetto. The conversation was that one friend said to him that he is racist against his own kind. What are your thoughts about that?
So colorism is the name of the bias that you're talking about, and it has to do with people having a set privilege and judgment, prejudgment and a judgment to a particular group based on stereotypes. And so in the same way that we can be infected with having stereotypes about another group, we can also have a stereotype about our own group. And so I think, when I hear that question first, I'm very hurt as a Black woman on a recorded webinar receiving that question. It's a pain point. But I think a lot of that is anchored in colorism. Colorism as well as racism has a lot of the roots in access to resources and how one is accepted. So I would imagine if one is looking for a dating partner, that they are looking for someone that they believe is going to give them more resources and accesses and connection to the lifestyle that one might want to pursue. And so when I hear those kinds of ways that people are not open to love in whatever form it comes, to me, it sounds really anchored in fear and prejudice that is clearly anchored in stereotype exposure.
Excellent answer. Thank you so much, Dr. Crawford. This has been such a rich presentation. We really appreciate it. And again, everybody, please do fill out the evaluation form. It's very important to us. So thank you, Dr. Crawford.
Thank you for having me.